Hi, my name is Amy Conrad, and I'm a pediatrician with the Hoag Medical Group at the Hoag Health Center Tustin Legacy site. I've been with Hoag for 2 years. Prior to that, I was working in Mammoth Lakes, California, and prior to that in Newport Beach, California. I attended medical school at UCI, and I did my residency in pediatrics at Children's Hospital of Orange County. I have 4 kids, and in my free time, I like to ski and hike and swim. I really appreciate you tuning in tonight on this lovely Friday night to hear some tips on becoming a family. Welcome. We're going to go through the slides first, and at the end we'll have a question and answer period. First, we're going to talk about some of the things that happen in the hospital right after we have the baby. In the delivery room, soon after, a few things happen. The baby will get a vitamin K injection, the baby will get antibiotic eye ointment, and hepatitis B vaccine. The reason for the vitamin K injection is that vitamin K is important to help us clot blood. And babies do not get it across the placenta, and there's very little vitamin K in breast milk. Babies also do not yet have any good gut bacteria that helps make it. And their livers don't work very well initially, which is also needed to help in clotting blood. So they get 1 injection of vitamin K, and that helps us in the first 6 months till they can eat regular food and get the vitamin K from that. The antibiotic eye ointment is to prevent any infections that they may get in the birth process. And the hepatitis B vaccine is to prevent the transmission of maternal hepatitis B in the birth process. The day after the baby is born, the baby will get a hearing test. Don't worry if the baby does not pass this the first time. Oftentimes, babies have some residual amniotic fluid in their ears, or they're just not paying attention during the test. And so often it does have to be repeated in the hospital, and sometimes it even has to be repeated a couple weeks later. Also, prior to going home, there will be a test for congenital heart disease. This involves just putting an oxygen monitor on the baby's arms and feet to make sure that we have the same amount of oxygen in the arms and legs. And this will detect certain serious heart problems that need to be dealt with right away. Also, prior to going home, the baby will have a newborn screening test. This is a test that will involve getting several spots of blood on a piece of paper. We'll go to the state, and it will screen for approximately 60 to 80 conditions, many of which you need to detect right away in order to prevent long-term complications. During the hospital stay, the baby will also be weighed daily, and you will talk to the pediatrician about what is the most appropriate way to feed the baby, when you need to go home. Lactation support is also available for feeding the baby while you're in the hospital and after you go home. One of the things I want to talk about that may be relevant to about half of you is circumcision. There may be some benefits of circumcision, including decreased risk of urinary tract infection, sexually transmitted infections, and cancer of the penis. The risks include bleeding, infection, damage to the penis. I really think a real risk is an unsatisfactory cosmetic result. And what I mean by that is, your son's penis after the circumcision will not look exactly like your friend's son's penis after his circumcision. And people tend to kind of compare among each other's children. And that does happen and sometimes leads to some concern on the parents, but eventually they all look fine. I kind of wrote down the official AAP recommendation on circumcision. And it says that the health benefits outweigh the risk, and the benefits of newborn male circumcision justify access to this procedure for those families who choose it. This is actually a very neutral position. It was written this way so that the insurance companies could not deny payment for it by calling it an elective surgery. But really, the American Academy of Pediatrics is very neutral on it, and it really is based on religious preference and parental choice. One thing that a lot of people don't realize is that the circumcision rate varies geographically across the country. In some states, it's much higher rate of circumcision than others. So it also varies with the socioeconomic status, race, ethnicity, as well as religion. Sometimes people will ask for a specific method for this child's circumcision. There's several different ways you can do it. And essentially, the method is whatever that doctor was trained in. So if the doctor that's going to do your son's circumcision is using a specific method, that's the best choice because they have done a lot of those. And really, the end result is the same no matter what method you use. Okay, so next we're going to talk about feeding the baby. I don't spend a whole lot of time talking about formula because breastfeeding is by far the best way to feed babies. There is all kinds of benefit in terms of providing protective antibodies, which decrease the risk of respiratory infections, gastrointestinal infections, sepsis, ear infections, urinary tract infections. There's also decreased risk of obesity in children later on if they have been breastfed, and there may be a slight improvement in IQ with breastfed babies. The one thing I really want to emphasize is when the babies are first born and mom is trying to nurse the baby, she will make colostrum. It is very low volume, but it has an amazing quality to it. That gets very frustrating to moms because they feel like they don't have any milk for their baby and their baby is really hungry. But babies are born with extra water. We know that they're going to lose weight in the first week after birth. And our goal is for them to get back to birth weight at 2 weeks of age. So in the hospital, we weigh the baby every day, and so we know whether or not we need to intervene, i.e. offering supplement formula or not. It gets very frustrating because moms are concerned that they're not making enough milk, and I just want to say, just stick with it, drink a lot of fluids, and leave it up to the nurses, the lactation consultants, and the pediatricians to help you make a decision in whether or not you need to supplement. If you need help, the lactation consultants are available while you're in the hospital, but you can also make an appointment to see them once you get discharged from the hospital. There's also private lactation consultants that will come to your house, and Hoag also offers the Pacify app where you can actually do video conferencing with a lactation consultant. Now, one of the important things that babies do is sleep. The average is 16 to 18 hours a day per sleep, which sounds like you're going to get an amazing amount of sleep after the baby's born. Unfortunately, it does not work out that way because they tend to sleep in short fits and then wake up, and they don't always want to sleep when we think they should be sleeping. They initially don't know night from day, and so they will often be asleep most of the day and then at nighttime wake up and not want to be settled down. They usually change this by around 2 months of age when they can kind of decide what's night and what's day. By 3 months of age, with good sleep habits, most babies can sleep 6 to 8 hours without waking up. The problem is a lot of babies just get used to being held while they're sleeping. So every time you put them down, they decide they want to wake up, and they'll only sleep if you're holding them. And that's one of the things that we work on, and we kind of educate you on how you get them used to sleeping, laying down in their bassinet or their crib without being held all the time. That's tough because it is fun to hold a sleeping baby. Some of the important information on sleeping to decrease the risk of sudden infant death syndrome is babies should be sleeping on their back in their own space, so not in a co-sleeper, should not be sleeping in a parent's arms while they're asleep, while the parent is asleep. We don't want any beddings, bumper pads, stuffed animals, any blankets in the bassinet with the baby. We just dress the baby warmly enough, and initially they can be swaddled in a swaddling blanket, but otherwise no bedding with the baby. Babies should not be sleeping on couches, cushion chairs, on parents' beds, even with a little DockATot, and there's some bedding that actually goes in between the parents, but that is not recommended. You want to avoid overheating the house. That's a risk factor for sudden infant death syndrome. And regular immunization schedule also decreases the risk. If you offer the baby a pacifier at the initiation of sleep, which means right when the baby's going to sleep for the first time at nap and bedtime, that can decrease the risk of sudden infant death syndrome. You have to be careful because you do not want the baby dependent on the pacifier so that every time they pop it out of their mouth, you have to go put it back in. Also, you want to avoid smoking, alcohol, and drug use around the baby, as these are also risk factors for SIDS. We do not recommend the use of home cardiorespiratory monitors as a strategy to reduce SIDS, and these are, among other ones, are known as like the Owlet. Next, we're going to get to crying. As you can see, she's going to start crying at 5 p.m. for no reason. Sometimes it's not at 5 p.m., sometimes it's at 1 a.m. This chart shows a graph of like the daily crying minutes versus age of the child. I think this is interesting because it shows that the average newborn baby cries 120 minutes, which is 2 hours a day. That actually goes up and peaks to closer to 140 minutes around 5 to 6 weeks of age. What this chart doesn't show is that since that's the average, the age, you can actually double that because you can actually have what they call high criers, and those babies are crying like 4 hours a day. Sometimes you get lucky and you get a low crier that's crying less than this, but the average is 2 hours a day, up getting closer to 3 hours a day. So let's say you fed the baby, you changed the diaper, you know the temperature is good, and you're still trying to figure out why is this baby crying. Sometimes they cry because they've had too much food. And by that, I mean they often need to suck. It's a reflex. It's a reflex so that they can survive. So if you put your finger in their mouth 24 hours a day, they will suck, 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 suck on it. Every time we do that, we think that they're hungry, so we continue to try to feed them. And some babies just don't know when to stop eating, and they may get a tummy ache from that. Once in a while, kids will not be eating enough. These are babies that are on the breast, and they're acting like they're eating. They're doing a lot of sucking, but they're not really swallowing. Or they're on the breast, but they're kind of falling asleep, so they're not really getting enough in. Sometimes they cry because they're too hot, they're too cold, sometimes they're overstimulated, sometimes they're bored, sometimes they have gas bubbles. We think with colic, it may be just more the brain is a little irritated, and the most likely reason is the question mark. We have no idea. But babies all cry. You just try your best to make them calm, and if they're still crying, then you just realize you've done everything and they will stop crying when it's time. Let's talk a little bit about vaccines. Vaccines are safe and they're important for your baby's health. Some of the concerns that parents have raised is that vaccines may overwhelm the immune system. I jotted a few numbers down here, and what the numbers are is 3,217, 3,041, and 123 to 126. Are the number of things called antigens that are put in the vaccines to stimulate the immune system. So in 1960, when we gave the children their normal childhood vaccine schedule, they received 3,217 little tiny things to stimulate their immune system. By 1980, with a normal vaccine schedule, this was down to 3,041, and by the year 2000, our normal routine vaccine schedule has just 123 to 126 antigens. So, although children get a lot more vaccines in terms of number of shots, the antigens, or the things that they get to stimulate the immune system, is much, much less than previously. It is less because we have just gotten much better at making vaccines. Another concern that parents have is that babies are too young for vaccines. Their immune system just isn't ready for things that are foreign. A couple things is, one is their immune system is immature, which makes them much more vulnerable to infection and thus the need for vaccines. Also, you can measure a baby's response to vaccines as well as their response to other things in the environment, and babies make a much more overwhelmingly positive response to other things in the environment other than vaccines. So what I'm saying is babies are exposed to many, many things that they're reacting to the vaccines that we give them are just a small part of what their immune system is seeing. There's several websites that you can go to research more vaccines. You can go online and Google and find all kinds of vaccine information, but you really want to pay attention to scientifically based websites when you do that. Can I take the baby outside? We're going to talk a little bit about COVID at the end, and I will say, give you my pre-COVID answer and my post-COVID answer. The pre-COVID answer is, yes, you can take the baby outside right away. I just don't want anybody touching the baby, coughing on the baby, breathing on the baby, or even looking very hard at the baby. So it's okay to take the baby outside, for a walk. I just don't want strangers coming up to the baby. I also want the baby to avoid people during flu season because babies in the first 6 months are too young to get their own flu shots. It gets a little bit more complicated with COVID in terms of risk. In general, babies are relatively spared from serious COVID disease. There is concerns that children may be asymptomatic shedders. So there is concern that the babies may get the disease and spread it to parents and grandparents and other people. So that's, I would be a little bit more cautious given COVID these days. Taking a baby home during the pandemic. It's hard after you have a baby, there's normally feelings of isolation and anxiety, and I think these have been a little bit intensified with COVID. And I think a lot of it has to do with we have less access to in-person resources, where in the past, we might have had close friends and relatives helping us out, but these days we're so wary of being around other people and then bringing our baby around other people or having other people come over to help, that it's making us a little bit more isolated. Also, we have more time watching TV, being on social media, and that really has been increasing everyone's anxiety. We've been doing those things because we haven't been able to do other things like go to the store, go shopping, do our physical activities. And again, I just wrote down here about in Orange County, there have been about 200 cases of COVID, but 2 hospitalizations, no deaths in kids. So again, it's pretty reassuring. I'm going to give you some pediatric pearls that when I just kind of was jotting down some things that if I as a parent really wanted to know the down and dirty on kids. Number 1, most of the things that you buy or you're thinking about buying, you probably don't need. When you go to any of the store websites or you just Google, what does my baby need? It will come up with 5 million things that you need, from outlets to snooze to things that help kids pass gas, and most of that stuff you don't need. You need a few outfits, you need diapers, probably don't even need wipes if you could get away with it. You definitely need a car seat, and you want to practice getting the car seat in before you have the baby because they're way more complicated than they probably should be. And on the next page with resources, I'll give you a book that talks about some of the things that will help you decide what you need. Number 2, all babies cry a lot, and it's very frustrating for parents. The babies are just trying to get their needs met, and they don't always know why they're crying. And it, is sometimes kind of tough and anxiety-provoking in parents, but just realize that you will get through that. Next, all babies make a lot of noise when they poop. They grunt, they groan, they draw their legs up, and their faces turn red. It's a big production for them, but don't worry, they'll get it right. Babies are also really noisy sleepers. They'll grunt, they groan, they make noise all night long. It drives you nuts if you're sleeping in the same room with them, but that's really normal. Sometimes they'll also have periodic breathing. Well, they'll breathe really fast for a couple minutes, and then they'll slow down, then they'll breathe really fast, and that's all totally normal. They also often sound like they have a lot of nasal congestion, and that bothers parents because you feel like you need to just suck snot out of their nose, but that's really normal in babies. Most babies also have imperfect skin. They have lots of rashes, they're very blotchy, their skin is really dry and peely. And that's really normal. They get that normal, beautiful, glowing baby skin about 2 months of age. Sometimes little girl babies have a little blood in the diaper in the first couple days after birth. That's nothing to worry about. It'll go away. It's also easier for babies to warm themselves up than cool themselves down, so we tend to kind of overdress babies. They only need to be in like one more layer than what you're wearing. And so you don't want to have bundles and bundles of clothes and blankets on babies. Another thing is you may notice with your baby is their eyes don't always go in the same direction. That doesn't usually happen until about 2 or 3 months of age. And so don't panic, they probably won't have a wandering eye. There's a couple resources, there's a few apps, there's a website, there's some books, and these books also talk about some of the things that you need to buy for the baby. It talks about vaccines. Be really careful of where you get your advice. You know, be wary of what people are telling you on social media, blogs, helpful advice from family and friends, because what works for one family and one baby does not necessarily work for everyone and is not necessarily the right thing for everyone. I'm going to spend a couple minutes talking about some of the changes that you will see with COVID-19 in the hospital. Hoag has done an incredible job of making it as safe as possible to deliver and to get your outpatient care. And there's a number of changes that have been implemented that sometimes may seem a little bit annoying, but are really to protect you and your baby. Everyone must wear a mask upon entrance to a medical facility at Hoag. Once mom is in the room, she may remove her mask. There are some OBs that are requesting that mom have a mask on during delivery. If you're going to have a planned C-section or an induction, you will get a COVID test several days prior to admission. If you come into the hospital and you have symptoms, like you have a fever or a sore throat or a cough, they will do a rapid COVID test, and you can usually get the results in 30 minutes to 1 hour. So if you come in and you're in labor and you have symptoms of COVID, it is okay. Come in. We are ready for you, and we're ready to deal with you. Don't stay at home because you're afraid of coming in. You think you might get denied care. Laboring moms can only have one significant person with them throughout their stay. So usually it's their one support person can come in with them and stay with them. Otherwise, there's no visitors allowed. When you come for outpatient care in the clinics, in general, we only allow one parent to come with a patient for exams. At the hospital, there's no flower deliveries, food deliveries only outside the hospital, which means dad would have to go meet the person outside the hospital to bring in food. If for some reason the baby ended up in the NICU, only one parent is allowed to visit at a time. If mom has COVID, if she's documented as having COVID, the official recommendation is separation from the baby for a certain period of time. The baby can be fed pump breast milk that's fed by the support person, because breast milk from the mom can be given to the baby. There's no concern about transmission with the breast milk. And the baby will get COVID tests at 24 or 48 hours. Moms can refuse this separation, and so if that's an issue at the time, if mom ends up being positive for COVID, then it's really important to talk to the physicians there about what the options are. And finally, the rules can change at any time, and they're rapidly evolving as we're getting more knowledge about the transmission of COVID in the perinatal setting. Finally, it's really important not to delay your child's care after birth because you're concerned about COVID. Again, in the outpatient setting, we've implemented a lot of safety precautions to make it safe for you to come into our clinics. When you come in, you will have a symptom screening and a temperature check for everyone that comes in. And again, only one visitor may accompany a patient to come into our outpatient facility. If you have a symptom, it's okay. If you have a cough or a sore throat, it's okay. It just means that you will be escorted directly to an exam room and you will not be in the waiting room at all. Masks are required for all patients, staff, and visitors, and for any child over the age of 2, that is able to wear the mask. And what I mean by that is sometimes you will put a mask on a 2-year-old and they will not keep it on. We will not refuse you treatment for your 2-year-old not being able to keep the mask on. The rooms are fully sanitized in between each exam. We've also staggered appointment times to allow for social distancing so that we don't have any crowds in the waiting room. We have markers on the ground, spaced out chairs in the waiting area. We also see well children in the morning, and we do our sick patients in the late afternoon so that we can completely physically separate the sick patients from the well patients. I also want to say one last thing about this PPE, the personal protective equipment. Don't be panicked if you see doctors wearing that. We have very strict requirements. We wear it anytime we have anyone with any sore throat, cough, fever, any kind of symptoms. So you're much more likely to see doctors walking around. That does not mean there's something bad going on. Now, we're going to go to questions. Okay. Hi.
Okay, so the first question is, what room temperature should we have at the house for the baby and water temperature for bathing? Do you want to repeat that?
Okay, so the question was, what's the best room temperature and what's the best water temperature? And the room temperature, I think it depends. I say 68 to 72. Some people will do it a little bit warmer, but I'd rather have it a little bit cooler. And then water temperature, I can't remember the exact number, but it's warm but not hot. Like you should be able to put your hand in it. The reason I'm saying it like that is I don't have a water temperature monitor at my house. You should be able to put your hand in it and your hand is warm, but you can leave your hand in it the whole time. So if you put the baby in and the baby starts shivering and shaking, it's probably too cold. If you put the baby in and the skin is very, very red, it's probably too hot.
Next question, room sharing. Is it a must, or can we leave the baby in his room and we stay in our room with a monitor? What will be the risk?
That's a great, okay, so the question is room sharing. Do we have to room share? And what's the risk if we don't room share? Is it okay to just have the baby in a separate room with a monitor? The official recommendation is that you room share, and the justification for that is twofold. There may be a slight decreased risk of sudden infant death syndrome, and it also increases the ability to breastfeed for longer periods of time. Now, given that, I also appreciate the fact that there's a huge range of what works for different families. And sometimes there's families where mom has to go to work the next day, dad has to go to work the next day, the baby's waking up 2 hours, every 2 hours to feed, or is a little fussy, and that may not be the right solution for every family. So I'm very supportive of what families do.
Next question. I have a 2-year-old daughter, and she's a picky eater. What's the best food for her that she will like?
Well, that's a real, okay, the question is, I have a 2-year-old that's a very picky eater. What's the best food that I can give her that she will like, I think is the question. That's probably something to talk to the pediatrician about. In general, the mistake that people make with kids is if they don't eat what we offer them for dinner, moms and dads worry that the kids are going to go hungry, and then they decide that if the child wants chicken nuggets, they're going to make chicken nuggets because they don't want the baby to go to bed hungry. And I think that it's important that you offer the child what you're eating, and they can choose to eat or choose not to eat. And most kids won't starve themselves if they're offered, a variety of foods.
Next question. Can a partner leave the hospital room or hospital and re-enter, come back?
Yes, they can. They will get symptom and temperature checked every time they come in, but they can leave.
Do you want to repeat the question?
Oh, I'm sorry. I forgot. I didn't repeat the question. The whole video thing is new for me, okay? The question was, I said that mom can have one partner throughout her hospital stay. And the question was, can the partner leave and come back, or are they stuck in the room the entire time? And the answer is, yes, they can leave to go get food, to check on other children, and when they come back in, they will get a temperature check and a symptom check.
Okay, next question. How long are you suggesting that families isolate after bringing baby home? When do you suggest it's okay for outside family and friends to meet the baby, with precaution, of course?
Okay. The question is, how long do we have to isolate for with a baby, and when essentially can we let other people around the baby? So, in general, the answer is I don't want a lot of people around the baby until after 2 months of age. I want the first set of vaccines in. Now, given that, I'm happy if you show the baby to other people that are socially distanced apart. That's okay. In terms of family members, it really matters how comfortable you feel with what they've been doing, if they're at any risk for infectious diseases, including COVID, and do you feel comfortable with them being around the baby? So if it's a close family member that has been healthy, has not had any COVID exposure risk factors, that has been practicing social distancing, is wearing a mask, it's probably okay to be around the baby, but otherwise it's better to wait right now.
On the same question, they're asking what are the, when can grandparents come and visit?
The same thing is if grandparents, and again, right now the recommendation is that people are still mostly cohorting with people that they live with. So if there's a grandparent that you have been around the whole time and you think that the grandparents have been not exposed to persons with COVID, then I think it's okay for the grandparents to be around.
Okay. Next question. Should I ask family and friends to get the Tdap vaccine before meeting our newborn? Also, what other vaccine should we as visitors to take before meeting our baby?
The Tdap vaccine is recommended for family members that are around the baby on a regular basis. So if someone that's going to be coming over a lot should have the Tdap vaccine. If it's someone that's just coming over, once in a while, it's not officially necessarily recommended, although I have had many families that have made it a requirement for them that they just wanted everyone that was around the baby to be up to date with the Tdap. And the Tdap is the diphtheria, tetanus, pertussis, and it's really the pertussis, which is the whooping cough part of the vaccine, that is what we're trying to protect the baby against. And then the other really important thing is the flu vaccine. You really want everyone around the baby to have the flu vaccine because they cannot get the flu vaccine until they're 6 months of age. And so we're trying to provide a kind of a cocoon of protection around the baby.
Okay, next question. What are the first appointments after leaving the hospital?
Oh, that's a great question, yeah. The question is, when are the first appointments after the hospital? In general, your first appointment is about 2 days after your hospital discharge. The pediatrician on the day that you go home will actually tell you when you need to follow up. Once in a while, we need to see you the day after discharge, but in general, it's 2 days after discharge. Then your next appointment is usually at 2 weeks of age, and then you have a 2-month, 4-month, and 6-month checkup. You don't have to worry about writing this all down or remembering this, because when you come in, we will always tell you when your next appointment is, and we'll make you the next appointment, and so you don't have to worry about remembering all this.
Can the vaccinations be refused if we so choose?
The answer is in the can the vaccines be refused? In the hospital, yes, you can refuse a hepatitis B vaccine. You can always refuse vaccines. There are many pediatricians, most of the pediatricians affiliated with Hoag will not take babies that don't have their vaccines. So you can always refuse vaccines, but you have to talk to the pediatrician that you're picking to see whether they're willing to see you. And the vaccines are required for school now.
Okay, next question is, how soon after bringing baby home can you introduce pets to the baby space?
So the question is, how soon after you bring the baby home can you introduce pets? I think right away. I don't think I would let the dog come up and lick the baby the first day, but you certainly want to get a baby blanket with baby smell on it and let the dogs or the cat snuggle with that. And you just need to keep an eye on it, because even though you have a dog, you may have an old dog that you think is really mellow, you never quite know what's going to happen when you introduce a crying baby into the house. Most of the pets end up doing very well and end up being very protective of the baby.
Can you talk about deep cleaning room prior to newborn arrival? Are babies more susceptible to dust, etc.?
The question is, what? Sorry, talk about deep cleaning, and are they more susceptible to deaths with that? Honestly, I'm not sure. I know there are some diseases that people have tried to link to cleaning, but otherwise I have no knowledge of that.
What if family, including grandma, who is a nurse and works at a hospital in Mass, would be traveling from out of state and flying? Do you recommend quarantine before meeting the baby?
Oh, that's, okay, the question is, I think, is it someone, a grandparent is a nurse that's coming from out of state? Is that true? I'm trying to get the question.
Traveling from out of state and flying.
And flying.
Do you recommend quarantine before meeting the baby?
The short answer right now today is yes. I'm not sure. I think that that's the safest thing right now in terms of a brand new baby. So that's a tough question, but I think the answer is yes for me.
We'll have a C-section. I live with my husband and my 4-year-old daughter. I don't have anybody in California to leave with her. Can she stay in the hospital with us? Thanks.
No. No.
You want to repeat the question?
Oh, sorry. I always forget that part. Oh, so the question is, she lives with a 4-year-old and her husband, and she's having a C-section. She wants to know if she can have the 4-year-old stay with her in the hospital, and the answer is no. They don't allow any other visitors.
Is there a risk of siblings, cousins interacting with the newborn because of COVID, especially as kids are back in schools?
The question is there a risk of cousins and other children interacting with babies given COVID now that the kids are going back to school? I think that's the question. And the answer is there's a risk with any child in school interacting with a baby in terms of the diseases that they can bring home. I'm not particularly worried that COVID is the one that we have to worry about them giving the baby, but there are a lot of them. And so babies that have older siblings and other relatives that are in school do get sicker than babies that are just kept at home.
Okay.
Mm-hmm.
All right, so this one's funny, but...
Okay, I'm ready.
She says, I don't like my mother-in-law. I tell her that the doctor says that she can't be around baby because of COVID concerns. Like, can you give us a letter?
Okay, apparently there's a question that mom doesn't like mother-in-law, and she wants me to write a letter saying that she can't be around the baby given COVID. And I have to honestly tell you, this is not the first time I've heard this question before. I'm often in the middle of issues when one grandma's doing one thing and mom doesn't like it, or one grandma's doing one thing, the other grandma doesn't like it. But I will always advocate for what's best for the baby. And if I felt like grandma was doing things that I considered risky, I'll tell you grandma shouldn't be around. But I also think that, it's better to try to re-educate grandma so that she can be around and enjoy the grandbaby. But I can't fix the mother-in-law problems.
Okay. Can you refuse the vitamin K shot if you choose to?
You can refuse anything. I mean, it's your baby. You have the right to refuse anything. I would highly discourage it because there is a disease called hemorrhagic disease of the newborn, and it has to do with the vitamin K, and I think it's really important that the baby gets it. And there's no evidence that oral vitamin K is effective. Parents have brought that up before. They wanted to try to do it orally and not do the injection, but we don't recommend that.
Is there any concern or risk buying a used mattress for the baby? You want to repeat it?
Okay, yeah. Is there any concern or risk of buying a used mattress? Off the top of my head, I can't think of any. I think you have to be careful with the cribs because the rules have changed a lot on the cribs. And so you don't want to buy an older crib. And I think with the mattress, you also would want to check the recalls. And if you Google infant recall, you can find devices that have been recalled because a lot of times things were recalled after the purchase. and you don't want to use anything that's been recalled.
How long should mom continue to social distance and isolate? No stores, restaurants, etc.
I think the question is, how long should mom isolate, social distance, no restaurants? I think that's a really hard question. I don't have a guaranteed answer. I think probably we should reevaluate in about a month. And by that, I mean, let's see what happens over, we've now been going to restaurants for maybe a week, maybe 2 weeks. And I think we need to see how safe those settings are. And if those settings look like they're going to be safe, then I think, maybe towards the end of summer that might be appropriate. But again, it changes all the time, and I think it's a really good thing to bring up with the pediatrician, because you're going to be seeing them after the baby's born, at the 2-week checkup, 2-month checkup, and so we'll have a better idea what's going on with this over the next couple months.
I will possibly have the baby early due to complications. How long can I stay with the baby in the hospital?
The question is, I will possibly have the baby early because of complications. How long can mom stay in the hospital? I think if mom has a C-section, she can stay for 4 days. And if it's a vaginal delivery, she can stay for 2 days. So after that, mom officially gets discharged. And if the baby is in the NICU, then mom will have to see the baby in the NICU. If the baby's in the nursery, that's on the regular floor, and then mom will see the baby there.
Can you discuss more about healing time for both circumcision and umbilical cord as well as cleaning?
The question is the cleaning of umbilical cord and circumcision and how long they heal. For the belly button, we no longer recommend that you clean it other than baby can have a sponge bath, so you don't need any alcohol or iodine on the umbilical cord site. You can sponge bathe the baby. The belly button cord falls off about 1 to 3 weeks after birth. In terms of the circumcision, the care of the circumcision is related to what method is used. So there's one method that's used where you don't have to do anything, and it has a little plastic piece on the end of the penis, and that falls off within a week. The other one doesn't leave anything on the penis, and so it's kind of red and healing afterwards, and that usually looks like healed up in about a week. The baby can have regular baths once the belly button has fallen off and the circumcision is completely healed, which is circumcision about a week, belly button 1 to 3 weeks.
I think this was answered, but Jennifer says I think we skipped it. So what to expect after birth and room transfers, and also if husband can stay overnight.
Okay, the question is what to expect after birth and room transfers, and can dad stay overnight? Okay, so dad can spend the night, yes. Room transfers, what happens is you have the baby, if you're having a vaginal delivery, on labor and delivery, and then a couple hours afterwards, they take you up to the mother-baby unit where you'll have a private room throughout your stay. If you have a C-section, you will go to the recovery room for a few hours, and then you will come up to mother-baby unit. Certain medical conditions, mom will stay on LDR, and the baby will stay in the room with you on labor and delivery if you need a higher level of care for the mom.
How long is your stay in the hospital for normal deliveries and C-section deliveries?
So the maximum in general is 2 days for vaginal, 4 days for cesarean, although with COVID, many patients are choosing to leave 24 hours after a vaginal delivery and 2 days after a C-section.
Okay. Jennifer, again, it says, I'm terrified of the delivery process, also terrified of feeling the pain. What can you tell me about epidural process? How safe is it, and how long does it last for?
Hi. So there's a question about being terrified about the delivery process and terrified of the pain, and a question about epidurals. I think feel confident that you're going to get through this, and we're going to help you get through it. And the hospital is so well set up for taking care of you, making you comfortable, making you not nervous. I would just not worry about that part of it. Yeah, it's uncomfortable, but we are well prepared. We've done this lots and lots of times, and it'll be okay. In terms of the epidural, again, that's a personal decision. The epidural will last as long as you need it to. There's some issues with the epidurals in terms of if you wait too long, then it doesn't work well enough. But if you do it too early, sometimes it can affect the dilation. And I mean, to me, those are kind of the biggest risks of it. There's not really a risk. I mean, sometimes moms get headaches after epidurals. There is a kind of headache that can be associated with it, but there's not really an association of paralysis, which sometimes people will say, oh, I knew someone that got paralyzed with it. That's not really a concern.
Does Hogue have a nursery for babies, or does baby stay in the room with mom?
The question was, does Hogue have a nursery for babies, or do they stay in the room with mom? They stay in the room with mom. There is a nursery where we take the baby sometimes when we have to do tests or when we need to keep a special eye on the baby for a couple hours, or where we do the circumcisions, but there's no nursery where there's any viewing windows at Hogue.
What are some good questions to ask when interviewing pediatricians?
So the question is, what questions to ask a pediatrician when you're interviewing a pediatrician? I think that's a really good question. I tell parents when they come to interview me that the most important thing is you're just getting a feeling for, does this seem like a person that you could work with? You can always change pediatricians, and I think sometimes we make parents feel really nervous, like you have to pick the right one. This is like the end of the world decision. And I tell parents, if you pick a pediatrician, you go, and it's just not working out, you're not gelling, then you can always switch. It's okay. So I think kind of whether you think you could get along with them personally or not, and whether they're open to your questions, maybe whether they're open to the kind of parenting that you see yourself. I think those are kind of the questions that are important to discuss. You can ask questions about, what kind of support they can provide for breastfeeding, what are their after hours, do they take phone calls from patients, do they take emails from patients, what's their sick well policy, do they have weekend hours, who covers when they're not there. I think those are all appropriate questions too.
May I ask your recommendation for women preparing to become a mom, especially during this uncertain time, like exercise, diet, habit, or maybe consider postponing the plan till COVID gets contained?
Say that one more time. Wait, I'm not sure.
I guess they want to know if it's a good time right now to get a baby, like get pregnant, go through it.
Okay.
Right now, that COVID.
Okay. So I think the question is right now a good time to have a baby? Is that right? Mm-hmm. I guess my answer is I think it's as good a time as any, in the sense that I think if we wait for everything to be perfect, there never is a perfect time. There's always things going on. I think there is a lot more anxiety right now, and a little uncertainty. There's more job uncertainty. There's some economic uncertainty. So I think if that's affecting your family, I think that's not unreasonable to delay pregnancy. But I think that otherwise, I think we're getting a better idea of what's going on with COVID. I think we're getting a better handle on it. So I'm not sure if that alone would, cause me to want to defer a pregnancy at this point.
Does Hogue have an ICU department?
The question was, does Hogue have an ICU department? NICU. Oh, NICU. Okay. So the Hogue has a NICU, a neonatal intensive care unit. So they can care for almost all babies, no matter how little and so sick at Hogue. Once in a while, if a baby needs emergent surgery, we do have to transfer them to CHOC, but in general, we can keep most of the babies at Hogue.
That's it for questions.
Okay, I guess that's it for tonight. Thank you very much for joining me.